Sometimes mothers get messages that breastfeeding is natural and it's easy. Sometimes breastfeeding can be easy with the first baby and hard with the second baby for the same mother. So it really just depends. You shouldn't stop breastfeeding if your nipples hurt. You should keep breastfeeding, but you should get help to see why it's hurting. They should see signs of hunger about 8 to 12 times in 24 hours. Newborn babies need to eat a lot because they're growing rapidly. They double their birth weight in the first 6 months of life or before. So you can imagine how much you would need to eat if you had to double your weight. It's not necessary to wash your nipples before you breastfeed because the breasts and the skin around the nipple actually produces good bacteria. And it's that good bacteria helps to prevent infections on the mother's breast.
Breastfeeding your baby is not just about giving them milk. You are feeding them and are also providing comfort and closeness. The ideal way to breastfeed a baby is called responsive breastfeeding. Responsive breastfeeding is a way to make sure your baby gets the milk that they need. It also helps you develop your relationship with your baby. Every time you give your baby a feed, you are helping to build and grow the loving bond between you.
Responsive feeding is comfort for both of us, so it's a two-way relationship. So I feel like I'm giving my children the best start in life. I know they're getting antibodies from there when there's winter flus going around. I know that I'm giving them comfort if they want comfort. I just love the bond that we have when I'm feeding her.
Our thinking around breastfeeding has changed a lot in the last few years. We've learnt more about how breasts and breastfeeding work and how babies develop. Parents were sometimes told that it was a good idea to try and get babies on a schedule. Sometimes they were told not to let their babies feed for comfort or fall asleep on the breast.
1. Make sure your baby latches. Correctly, asterisk baby should open their mouth wide and take in the entire nipple and most of the areola, not just the nipple tip. Asterisk baby's lips should be flanged outward, chin touching your breast, and nose free to breathe. A good latch equals no pain. Baby sucks rhythmically, and you can hear swallowing. 2. Use a comfortable breastfeeding position. Asterisk. Common positions include cradle hold, cross cradle, football hold, or side lying. Use a nursing pillow to support your arms and help baby align with your breast. Both you and baby should feel relaxed and supported. 3. Don't let baby comfort suck too long. If baby is no longer actively drinking and just suckling for comfort, it may irritate your nipples. Set feeding routines and avoid constant short feeds.
Breast milk is an excellent and perfect source of nutrition for infants. Here are the main components of breast milk and the effects of each substance. 1. A protein. Protein has antibacterial effects, helping to prevent bacteria from entering the body. 2. Fat. Fat in breast milk provides a large source of energy and supports brain development. Fatty acids such as DHE-docosahexaenoic acid and arachidonic acid are essential for brain and eye development. 3. Vitamins and minerals. Vitamin A, important for vision, the immune system and tissue development. Vitamin D helps absorb calcium, supports bone development. Vitamin E, an antioxidant that helps protect cells from damage. Vitamin K supports blood clotting. Calcium, phosphorus, magnesium, necessary for the development of bones and teeth. For immune cells, white blood cells. Protect children from bacteria and viruses that cause disease. 5. Water. Breast milk contains about 88% water, helping children maintain water balance.
Sure, here are 5 benefits of breastfeeding. 1. Nutritional superiority. Breast milk provides optimal nutrition for infants, containing essential nutrients and antibodies crucial for their development. 2. Immune system support. Breastfeeding boosts the baby's immune system, reducing the risk of infections, allergies, and chronic diseases later in life. 3. Bonding. Breastfeeding fosters a strong emotional bond between mother and baby through skin-to-skin contact and nurturing interactions. 4. Convenience and cost effectiveness. Breast milk is always available at the right temperature, requires no preparation, and is free, saving time and money compared to formula feeding. 5. Health benefits for mothers. Breastfeeding can lower the risk of postpartum depression, breast and ovarian cancers, and may aid in postpartum weight loss by burning extra calories.